what drew me to you was obviously your background in nursing. And ultimately, you and I both we take care of patients. That's our goal, is to have them be the healthiest and happiest that they can be. So can you start by telling us about your background and what led you to focus on nursing education and technology? Because not everybody has an interest there. What drew you to that?
So I definitely have a bit of a windy path. It was
Okay.
this where I am at now isn't what I ever planned for. I certainly went into nursing planning to be at the bedside for my entire career. I grew up as a nurse at Duke, working in the intensive care unit, the emergency department, all in pediatrics. I'm a peds nurse at heart. You can't get me to take care of adults. I later went on to become a pediatric nurse practitioner. But really where my story got interesting was during the pandemic, I was placed in the emergency room for most of the time that I was working on that time period. And I saw a really big shift in how prepared new nurses were when they came to join our workforce. And it makes sense when we think back on it. We had very few resources. They weren't getting very much clinical hours with that hands-on experience that we know is so vital. But then doubly, they were coming into a very high intensity, high acuity environment and not having a robust support system to really get them up to speed. There was just such a lack of mentorship and support that, as we see now, they're leaving the bedside really fast. I just read an article Ballard Health just put out. 50% of nurses are leaving within their first 2 years. And I'm like, that's less time than you spent learning how to be a nurse. And so all of that really didn't sit right with me. I knew there had to be a way we could be doing things better. We had to be more innovative with how we were educating this next generation. So for a while there, I kept working at the bedside and began looking into some opportunities on the side for how I could dip my toes into education. What else was out there? What's currently being done? And how could we maybe start to think differently about that? And really where the tech savvy comes in is trying to solve for some of these major issues and needing technology to needing to innovate with how are we going to educate more nurses to maybe one day be out of a nursing crisis? How are we going to grow this pipeline of future healthcare professionals? And I'm no tech whiz, but I've learned a lot as we've tried to think about different ways to approach these problems. And it's all just stemmed from that love for educating first my patients and clients and then my students, and how we can really make sure that next generation of nurses is here to stay.
You touched on something that I can relate with.
Hey everyone, big shout out to Ariel Vivleka, founder of Finally All Natural. Ariel is on a mission to educate people about hidden ingredients in skincare products. Did you know the FDA allows incidental ingredients that aren't labeled or disclosed? That's why Finally All Natural is special. They focus on how ingredients are created, excluding extracts and essential oils, and have world-first formulas that work for a variety of skin types. They've also partnered with CleanHub for eco-friendly packaging and offer an exclusive organic face oil that has been scientifically proven to boost the proteins in your skin, enhancing hydration and strengthening the skin barrier. All 100% vegan. If you're into holistic skincare or non-toxic living, Ariel is your go-to expert. Keep up the amazing work, Ariel. Get in touch with her today. All the links are in description below.
You mentioned a nursing shortage and that nurses are leaving in the time span that they educated and trained themselves. Do you think that has anything to do with COVID, or do you think it's the state of nursing or medicine as we speak, because I'm a primary care physician, I have a special interest in women's health, but there is a severe, and we've been predicting and telling people this all many years, even before COVID hit, that there's a serious, shortage of PCPs out there. So, and I know, exactly what's been going on that has led to this. But what has been going on in nursing? Because it impacts me, it impacts the patients. What's going on?
Absolutely. It impacts all of us. I don't care who you are. At some point in your life, you are going to have contact with a nurse, whether that's you directly as the patient, whether that's as a caregiver for a family member. You will have contact with a nurse, and you want that nurse to be well-educated, compassionate, competent, empathetic, all of these great things. But if we're not putting the structures in place to get them there, and then when they do go into the workforce, they're leaving that quickly, we are all going to end up in a very bad place. And we're really starting to see that. So to back it up, do I think COVID helped the situation? No. I absolutely think that had a key triggering effect on some of our educational systems, namely just less resources and less hands-on resources to work with our students. And we're starting to see some of that get walked back, but not all of it. A great example here is that for nursing faculty, we are getting less and less people going into academia and actually being willing at an institutional level to educate these nurses. And how do you grow a profession without faculty there to teach them? There is obviously going to be a need for us to do things a little bit differently. That being said, many of the reasons that I see contributing to this existed long before COVID. The staffing ratios, the burnout, and the number one thing that I feel contributes to it, at least on a personal level, is just the nurses eat their young mentality. This has been a saying for far too long in our profession with how we interact with and treat with these new novice nurses. And oh my goodness, who wants to stay in an environment where they're being eaten? It's just not conducive to happy, thriving careers. And that has been going on for a very long time. It certainly predates COVID. And people are done with it. People are fed up and they're getting out of there. And if we don't really change how that looks from the get-go, they're not going to stick around.
I think that we've seen that in medical school. I think it is somewhat transforming in medicine, although I haven't, been in residency for many decades, so I can't truly attest to it. But there's a mentality that, at that time, that it was an apprenticeship. And where I trained, and I'm not going to say it because God forbid nursing leadership. Dr. Rednell, why did you talk about it? I do remember when I was I'll just say it, at NYU, some of the nurses and how afraid they were of nursing leadership and their managers. And it was very similar to what we went through as young residents and being afraid of certain attendings.
I want to take a moment to give a huge shout out to Melissa Murphy-Pavone and her amazing team at Mindful Financial Partners. Melissa has over 18 years of experience as a certified financial planner and divorce financial analyst. And what truly sets her apart is how she values people over portfolios. Whether you're going through major life changes or just want to take control of your financial future, Melissa's approach is all about aligning your wealth with the life you truly want to live. She doesn't just focus on growing wealth, but also on creating balance and purpose in your financial journey. You can get in touch with her at her website, mindfulfinancialpartners.com, and you can find all the links in the description. Be sure to check it out.
I don't see how learning is the most fruitful in those circumstances, because if you're afraid in general, then you're going to be afraid to ask questions, You're going to be afraid when you do make a mistake. And as we both know, medicine, nursing, what have you, there's no such thing as perfection.
Oh, yeah.
But we're all human beings at the end of the day. But if you're in this fearful environment, then yes, I can see how that can lead to a diminished population of nurses. And people might be wondering, why am I talking about this right now? Because, as I mentioned, it's impacting us, not just me as a doctor, but it's impacting my patients where they feel frustrated. So patients are wondering why their questions are not being answered when they call the office, because it's all tied. We don't work separately. Doctors and nurses work very close together. And if I didn't have good nurses helping me, then I would just be totally overwhelmed. So here's where you step in, right? How, with the nursing education, the challenges that you have mentioned, how do you step in transforming that and educating nurses that we do have with tools and tech? What do you do to help?
Yeah, I see really 3 key buckets that need to be addressed. And I speak to nursing education because that's the world I live in, but I do believe this applies more broadly to healthcare education, to our residents, to our allied health peers. There's so many people that are part of this interdisciplinary team, and it doesn't work unless we are all there and collaborating, especially when we have more complex and critically ill patients. We just all have to bring our knowledge to the table. So the 3 big areas that I see us being able to actually affect some change is first growing the pipeline of future healthcare professionals. So for me, that means helping really early on, not just introduce them to the career, but provide them with actionable resources that can help them get there. That might be taking your entrance exam for nursing school or the MCAT if you're going to medical school. That takes resources. That's very challenging. So let's guide students to that and provide from day one compassionate, empathetic material that instills in them that they have a guide, a mentor, a cheerleader that's going to get them there. I really do think that starts before they're even in their program. The second big bucket that I see after really growing that pipeline of future professionals is making sure that once they're in that pipeline, they stay there. So for me, that's reducing dropout rates. We see a huge cliff that first year of nursing school, and I would not be surprised if other healthcare professions like medicine and our allied health professionals have similar experiences. It is very challenging, and honestly, it should be challenging. I have no problem with that. But we need to support the students through it every step of the way, again, so they have mentorship and support. The third bucket is, hey, you've graduated. You're now a resident. You're now a new nurse or speech therapist. How do we support you to keep you in the profession? So that's career advancement and growth through continuing education. That's for nurses, potentially advancing your career with a doctorate degree, becoming an advanced practice provider. There are many different pathways out there, but A, students don't know about them, or B, they don't feel supported to follow them. So I seek to really create a continuous learning platform from day one throughout your professional career that supports, guides, and keeps you moving on to the next step with confidence. There has to be some innovation in how we deliver that material, but when you boil it down and really get to the soup and nuts, that's my core belief at how we can affect change for our future healthcare professionals.
Are you a woman with big financial dreams but no idea how to reach them? You'll love working with Dr. Annie Cole, a money coach who's on a mission to help women earn more, build wealth, and retire early. In her 20s, Annie was a burnt out social worker, struggling on a $26,000 salary. By her 30s, she had climbed the ladder to a vice president role, invested over $350,000, owned $1 million in real estate, and cut 20 years off of her retirement date. She now runs her own coaching business, Money Essentials for Women, and inspires women to step into new levels of money mastery and confidence. Ready to see how Annie can help you? Set up a free financial consultation at www.money-essential.com/coaching. While you're exploring her services, grab a copy of her new book, 101 Ways to Build Wealth, at money-essentials.com/book.
And similarly, what's recruiting for the Marines or the Army, right? Sometimes they go into environments where you may have to go to places where they need more direction, right? And so in medicine, and the way that looks is that over the years, students and residents who go into primary care, they may get their loans paid off, right, by the government, or they're making it more accessible for students who don't have the means or the resources to go to medical school. So how does the nursing profession recruit those kind of people so that people who don't have access to that, how do you do that?
Yeah, no, you touched on two of our big value words where I work, which is accessible and affordable. That's honestly part of what we feel is our key driver, because unless this education is accessible at an affordable price, then we are going to miss out on really valuable future healthcare providers. So something that really sticks out to me at Archer Review, a big proportion of our students are international. So the Philippines, we have many students in Africa, Ghana, Kenya, and they are seeking to take their national licensure exam and immigrate to the United States. Let me tell you, the barriers facing those students are nearly insurmountable sometimes. They need to travel 12 hours to get to a testing center, just really trouble with internet connection to even access the material. And of course, the cost barrier, the cost for entry looks very different than someone who maybe lives in New York. So really, that is not an area I knew a lot about until I started working with these students and realized that accessibility and affordability are shaping who is even able to enter this profession. So we do a couple of things to at least help with this. I'm not going to pretend like it solves the problem, but offering scholarships, doing reach out to certain areas like that to try and provide those resources at low or no cost. I do know we have similar programs with loan forgiveness. I think that's a great point you touched on, because many of these students will take out quite hefty loans, and that's a big thing to think about in your long term.
It can be very daunting. I'm a dinosaur, so a comparative dinosaur. So, what I came out with, I think, is a mere fraction of what medical students come out with when they're done with medical school. I was also be going up and up faster and faster, doesn't it? It's crazy. I think my 4 years of medical school is equivalent to probably a year and a half tuition for college, certain colleges.
Oh my goodness.
That's how much things
have changed. Big time.
And I went into medical school thinking whatever figure, because med school was on me. I paid for it. I figured out how to pay for it. But while I was there, I was like, it seemed like an astronomical amount to me. Mm. But these days, it would be nothing, honestly. So I consider myself lucky. So you were mentioning some of the challenges. And at Archer, how do you make up for the education challenges for the nursing students?
Yeah, this is something that has been a big act of learning as we go. We set out with a vision to really make this education accessible and affordable, but we didn't have a perfect roadmap for exactly how that was going to look. And our key principle is that we keep our ear to the ground, listen to user feedback, and rapidly adapt according to what they're looking for. So for example, I tend to talk a little bit fast when I get excited. I'll be really passionate about like congenital heart defects and I'm going a mile a minute. They're like, that's not going to work for us. So we built in very simple features of closed captioning and adjusting the speed for lectures. And many of our students will slow certain parts down as well as follow along with a transcript. That transcript can also be auto-translated into any language of their choice so that they can read along with that lecture in their native language. And all of those are small things. That's not the tech revolution of the century, but it goes a very long way in starting to break those barriers down. The other thing we did that we really worked quite hard on was building a very diverse tutoring staff, fluent in multiple different languages, so that we could all pivot when we had a student that was struggling with this and spoke Spanish, or a student from Africa, and we have different time zones covered. Time zones is a big one that when you're dealing with one-on-one tutoring, sometimes you don't think about. Not everybody lives in my same time zone. We really had to make sure the staff we built was representative of everyone we wanted to serve. And we will continue improving upon that every single day. But as long as we do it with intention, we listen to what is and isn't working for our students and keep making it better for them, I do believe that ultimately we'll get there.
I really thought carefully as to, why I wanted this on my podcast, because it automatically does not spell women's health. But for me, it does, because I take care of so many women and so many women patients who feel frustrated with the state of medicine. So hopefully it helps shed a light, like I said, as to what we're dealing with and then the struggles that we're trying to make up for. Right. So I wanted to thank you so much, Morgan, for being on my podcast. And I wanted to also allow yourself to talk about where we can find you, all the great work that you're doing. Where can my listeners learn more about you?
Sure, absolutely. No, and thank you very much for having me here. I agree completely that for women and women's health, making sure that we prioritize bringing up this next generation of nurses in the right way will pay dividends for ourselves, our future children. It will go such a long way. So I can be reached at archerreview.com is our main site where all of our students join for our material. We're also on all the socials. If you do any of the Instagram or the Facebook at Archer Nursing. And then you can find me personally on LinkedIn as Morgan Tailor.
Awesome. I will make sure to share all your handles. My listeners can find you.
Wonderful. Beautiful. I thank you again for the opportunity. I look forward to continuing to listen to your podcast and learning more and more from you. It's a great time.
Thanks, Morgan. Thank you so much.